Welcome back to another episode of Primal Reset podcast. Today, we're diving into the future of women's health with Dr. Noble. She's a board-certified OBGYN and a certified menopause practitioner who's changing the conversation around hormone health, aging, and preventative care. Robin, it's a pleasure to have you on the show today.
Thanks so much for having me. I think, the more information we can get out there to improve awareness, the better. So happy to participate.
Absolutely, and we're happy to have you. Share your story with us. What got you into wellness? What got you to speak on menopause and trying to help others achieve better health in their life?
Yeah. So, I think what got me into wellness is really what got me into healthcare, right? What got me into medicine. And probably that starts an awfully long time ago, being a starry-eyed undergrad working at the National Cancer Institute. I, I thought I wanted to learn how to, cure cancer, work on independent research, and really move the needle on kind of bigger chronic diseases. And then I think my personality really served kind of individual patient care better than bench research. So I made my way into medical care pretty quickly, kind of segued from bench research into medicine. And then, I fell in love with the OBGYN as a medical student and as a resident, used to perform, the whole scope of OBGYN care, including obstetrics. And then in about 2007, I really felt that it was difficult to manage my own family and call responsibilities. And I ended up moving out of obstetric care into gynecology. I have a fellowship in minimally invasive gynecology, so it was kind of a natural transition for me. And then I really just found there was a tremendous unmet need for management of women's midlife care, which is incredibly interesting to me because it's very nuanced and it's where things change a lot. A lot of people aren't really aware of the importance of that menopausal transition. And with the issues and the interpretation of the WHI in the early 2000s, the thinking surrounding hormone therapy had really changed. So I practiced in the 90s when we were doing a lot of hormone therapy. And then I lived to see all the changes that happened in the early 2000s. And really that, I would say that time really helped me understand that, medicine can often be a big pendulum, and we can think that, something's, as good as sliced bread. And then we can decide like, oh no, actually there are problems with that. We shouldn't overdo this. And I think that perspective, having practiced, for years, really helped me understand that there's a huge need for a balanced discussion around aging, hormone therapy. I'm also boarded in lifestyle medicine, which is kind of evidence-based preventative care. So I've always been really committed to partnering with a patient and improving their own health, making healthy choices, partnering with them in terms of what's realistic for them and what appeals to them, what their philosophy is. So I think it's, a natural area for me because all of those things intersect.
Absolutely. And expand a little bit for me on the preventative side of things, working with a client. What does that look like? And in what form? Are we looking nutrition-wise, fitness-wise, kind of the overall?
Yeah, all those things. We really focus a lot on preventative care in medicine. And in fact, in the US, we don't focus on it enough. But things like routine screening, pap smears, mammograms, cholesterol and lipid profiles, looking at people's blood pressure. We have so many systemic problems in US healthcare right now that getting people in the door and recognizing that some of these basic tests, including colonoscopy, but also a broader awareness of kind of our food sources, our diet, our habits. I think we know more and more that lifestyle informs kind of our chronic disease risk, including things like dementia and cardiovascular disease. And even people's perspective is often really skewed. They might be really concerned about their breast cancer risk and not really understand that cardiovascular risk is much higher for them. And that risk of dementia and even osteoporosis is almost like the silent killer in women. So I think I'm really focused on kind of education, awareness. That's what I'd love to do. I love to teach. So I love to teach my patients, things they might not have been aware of that can really make small changes. And I think one of the real issues we all face are making positive changes, right, that are good for our health. And how is that sustainable? And how do we reframe our thinking so that we can make kind of smaller, sustainable changes that fit within our lifestyle? And we need to be kinder to ourselves. If we bite off more than we can chew, we generally are not successful for very long.
Absolutely. See, I love that point that you made where the small changes is what really we can make sustainable. When my opinion is, with a lot of people in the general population, when they want to make a change, they look at the overall picture. And if you look at the overall picture, I mean, there's so much out there that we could talk
Yeah.
about, like just in nutrition wise, or just in fitness wise, or just in hormone wise, or I mean, it goes so far deep that if we really want to make a change, when we look at the whole picture, there's too much. We have to change our entire lifestyle. It disrupts everything. It disrupts sleep, work,
Right.
relationships, you name it. But if we take that small step to have someone like yourself kind of walk us through, what can we start today?
Right.
Can I drink a little bit more water
Right.
today? And then tomorrow or next week, I can start on something new as
And
well
I
to
think
kind of keep that lifestyle
you've got
still in
to
check.
find the time where, finding time is another huge challenge in US healthcare, but it's actually that awareness of what might be the most impactful. For some people, they're more sedentary. For other people, they might eat ultra processed foods. So it's taking the time to identify not only where you can make an impactful change, but what are their highest risks too? Is there risky behavior? Are there small things? But I think you're right. We all need to see these successes, right? If we don't see little successes, we won't be able to kind of maintain that trajectory. And when we talk about healthcare trends and kind of being overwhelmed in general with this information age, people can kind of latch on to the next best thing, this panacea, this anti aging thing, this supplement. And sadly, they spend a lot of their hard earned money on things that don't have a lot of evidence behind them and sometimes can potentially be harmful. So I think it's kind of reining some of that in and partnering with someone and meeting them where they are so that you can help them make the best decisions for themselves. Because if we don't do that as healthcare providers, we lose the patients to TikTok and where they get their information. And if we can't meet them where they are and speak to some of the trends that they're interested in, that they bring to me, the real challenge is I have to keep up with, evidence-based medicine and best practices, but I also need to keep up with what information people are getting. Because if I can't meet them there, then I'm going to drive them to different places where they might get kind of nefarious, profiteering information. So I really try to pride myself on kind of being aware and being humble. US healthcare, we've made a lot of big mistakes too. So I think, you have to have that humility to partner with a patient and say, like, well, what did you find out? If I don't know about that, I will look into it. Like, I don't know about the newest, I can't possibly know about the newest information on everything. And I think healthcare providers need to be more comfortable admitting that and recognizing that a lot of our patients come in now with more information on one subject that we might be aware of.
Absolutely. The ego is the enemy in that aspect. We've done this for such a long time. It's been a certain way for so long that we don't need to learn more. And to your point, I love that you're always trying to stay on top of trends and meeting those patients to their knowledge and what they've seen. And TikTok and
Yeah.
social media in general is always kind of pushed sometimes in the wrong direction. But I wanted to ask you, with that being said, with all the generalized information out there on TikTok, on social media, how are you able to take the patient is watching any of those videos or taking any of that advice and speak to that client in a way where they're able to understand their own body and you're able to kind of pinpoint what can help them at the
Yeah.
start?
I mean, there's so much there. I think we have to remember that if it sounds too good to be true, it probably is, right? So I tend to come back to common sense a lot. And I tend to tell people, even if I don't know about it, don't spend too much money and beware, like buyers beware. Like any of these programs that are making a lot of money and selling a lot of things and selling a lot of promises are probably not true. So I think that can be a starting place. And I haven't seen everything that they've seen, but I think if I can speak to that, that's helpful. And then I think, so many of us are driven by different, I think, different fears and worries, and whether it's appearance, whether it's, aging and chronic disease, I think we have to realize there's a lot of anxiety. And if somebody feels that they can kind of soothe themselves by spending a lot of money on some new supplement, we have to address the underlying anxiety too, right? And we have to try to help them make some real changes that won't just be a fad.
I love that. It's a very personalized way of care, and we haven't seen that too much in the past, especially with social media just kind of being a generalized, this worked for so many people, so
Right.
it'll work for
Yeah.
you. And, it's not always the
And
case. Sometimes it will, and sometimes it
yeah,
won't.
speaking to my colleagues, I mean, I think, or speaking of my colleagues, I think every physician expects to have lifelong learning, and we're always trying to keep up with the new trends, the new changes, the new data. If anything, it's more overwhelming than ever. New journal articles, whether they're speaking to certain cancer screening, dietary information, environmental health issues. So we're always learning. Where I think a lot of people miss the boat is actually in that humility and in that willingness to say, I don't know, and that willingness to accept that a patient might not want what you think is the best thing to do. So I think we run into problems when a physician thinks this is so obvious to me. They should get a mammogram. And when they don't understand that that person might have other fears and they don't take the time to understand what their reluctance is, we kind of butt heads, right? And then you don't serve the patient. There's that. And I think doctors, are human too, and they're threatened by some of this. I mean, I think a lot of the doctors still practicing, learned in an information age where they had the answers or they thought they had the answers for the patient. And now patients are coming in with a lot of information. And it's really hard to practice in this era and be able to navigate that and say, I know an awful lot. I think I know what might be the best thing to do, but I don't know that. And I think it's, we have to understand that they feel threatened too. And we're all pressed for time. So the time crunch, the threat, the uncertainty, and generally people are really trying to do the right thing. But that's what saddens me is when we just cross wires and the person goes to TikTok and we've lost that opportunity to have an impact on their healthcare.
Yeah, it's before social media started to become super, super popular and Google first came out, it was Dr. Google.
Mm-hmm.
And we always try to say, don't listen to Dr. Google because you could say, what is this black spot on my skin? And it could come up as 300 different kinds of things, So
But we still all do it.
always try
We
to go
still all
to
do
the
it. Even
profession.
doctors do it.
We still
And whether it's
do it. We still,
WebMD or it's
unfortunately,
Google,
we
it's a
do
place to
it.
start. It's 10 o'clock at night. We need to recognize, people say, don't go to Dr. Google, but we all do it. So be realistic. You've seen it. You know the worst possible outcome.
Absolutely, yeah. And we need to find people like yourself
Oh,
who
thanks.
are professionals within the space and who have done years of studying research and actual tests, or not tests, but have proven results as to what you did for patients. And you have that idea how I can help multiple people because not everyone is the same. So looking at Dr. Google or finding everything else on WebMD or anything in that matter, social media wise, is it's not always going to be the most accurate thing. Finding someone like yourself is
Oh,
definitely
thanks.
my advice to almost everyone as well. I try never to give medical advice to anyone. What works for me might not work for you. But to the point, I know we spoke about menopause earlier. We're seeing a big educational push on menopause. I've spoken with a lot of leaders in the space who are focusing on menopause as well. Is all of a sudden driving this educational platform for menopause, and what do we need to
Yeah.
change?
So I think what's really changed is the demand. And I think a lot of women have become aware. Frankly, we should have helped them become aware 20 years ago when this data was kind of misinterpreted and what came out in the general media was not kind of a balanced interpretation of the results, right? So mistakes were made. I don't want to use the word misinformation, but I would say the whole story wasn't there. And we learned a couple things. We learned that it was very different to give people hormones right around the time of menopause than it was to give them when they were 10 or 15 years into menopause. And that was lost in the beginning. We didn't understand that. So once we started to understand that there's a huge difference between putting somebody on hormone therapy around that transition and their increased risk putting them much later, we kind of understood that it's very different for women transitioning through menopause now, right? So we understand there's choice. And I truly believe that there's not a right answer, right? We've got the really fascinating questions about what's normal aging and what can we do about it and what's preventative care and what opportunities do we have. So I think people are now aware that there's not just one way to travel through menopause. And each person's symptoms are very different. Some people really suffer from symptoms and haven't been getting help. And other people are kind of blissfully unaware. But they might have increased risk for things like osteoporosis and not really be aware that we maybe need to step in or have an opportunity to step in. So I think what's changed is there's demand and there's an awareness, and there's not a one size fits all approach. Okay. And now people are scrambling to meet that need, which is good. But we've got a lot of people in the space making a buck off of it as well. So there are a lot of people preying on vulnerable people that don't have access to healthcare providers or clinicians that are actually answering their questions, meeting their needs. I'm sorry, I have a very excited Labrador retriever down here. But so I think,
You were all good.
there's a huge demand. It's unmet. We haven't done a good job for these people. And we've got a lot of people that are entering into this space, especially because there's a huge financial opportunity for people, whether they're well-meaning or not so well-meaning alike. So huge opportunity, tons of money going into it, a lot of demand for good reason. And I think that's where we are.
I agree with that. It's a newer space in the education wise for menopause, and the studies that have came out recently on how we can help prevent menopause, or at least start the process of trying to prevent, or at least ease menopause symptoms. For everyone that's out there, I know we throw menopause around kind of left and right. We are in the industry. What is menopause
Okay,
exactly?
so menopause is the cessation of normal ovulation and ovarian function. So, to kind of dumb it down, it's the cessation of ovulation, reproductive potential, and the production of the reproductive hormones, estrogen and progesterone. And with that sudden decline in hormones, we see changes in almost every organ system. People have hot flashes, they have changes in their cardiovascular system, they have changes, in their bone health, their diabetes risk, where they put their adipose tissue. So there's so many different changes. Some people can have significant mood symptoms. So there's a lot of impact on the hormones in the brain. So we've got, mood and sleep and hot flashes, joint pain, for some people, bone loss, changes in metabolism, weight gain, and where we put our weight. So for some people, they can have just a constellation of symptoms. For other people, they can have a few hot flashes, their periods stop, they no longer have to worry about, say, an unplanned pregnancy, perhaps. And they might have, an improvement in their mood, or it kind of settles down, because when we're ovulating, we often have these ups and downs of our hormones. So some people transition into menopause and feel a new sense of kind of peace and ease. Other people really struggle with sleep and mood. So it's a unique process, right? Informed by our genetics and our lifestyle. And, we're learning more and more that there are probably even socioeconomic factors and stressors that can exacerbate. And we know there are there are differences in ethnicities as well. So some people experience, more hot flashes and more sleep disruption for longer periods of time. Other populations can have kind of more in the form of joint pain, but not really kind of as many mood symptoms. So that's menopause. It's when those
Interesting.
hormones stop.
Interesting.
And then that question is, does somebody want to give some hormones and not experience those, or prevent some of those changes that happen in all those organs? And so there's not a right answer here. Some people want to age gracefully, and they might not really be terribly symptomatic. Other people might, it might rock their world, and they need options. And those can be both hormonal and non-hormonal. So we've got a lot of options. It doesn't just have to be hormones. And I think that education, even understanding what's happening to someone's body, that's powerful too. Because if they can understand why, they can then maybe double down on the preventative care, the exercise, the healthy eating habits, better sleep hygiene. So there's a lot that can be done without medications, but there's an awful lot that can be done with medications. And it's an opportunity to screen people for some of these risks that really change at menopause, like osteoporosis and cardiovascular disease. 1 in 3 women will die of
Interesting.
cardiovascular
Interesting.
disease, but an average risk person in the US has about a 1% risk of dying of breast cancer. So we have much higher risks of cardiovascular disease, and most women don't know that. And they're more likely to die of complications from a fracture than from breast cancer.
Interesting. So when you mention preventative, what's the first step? What's one step that a woman experiencing or knows that they will experience in the future any menopausal symptoms?
So
What's the first step that they
I
can
think the
take to
first
prevent?
step in my mind is being aware that any of these symptoms could be attributed to that menopausal transition. So all these new things are happening. Wait, maybe this could have an underlying hormonal cause, right? So that's kind of number one, being attuned to it. Number two is having that relationship with a primary care provider, because those screenings like blood pressure, lipid profile, cardiovascular risks are so high that we need to get them in. We need to, manage obesity if that's an issue. We need to manage mental health issues, right? So primary care is really that first step for preventative care. And then ideally, really having access to someone that understands kind of the uniqueness of the menopausal transition and what the opportunities and treatment options are. Because so many physicians are unfortunately not well versed in kind of the whole array of options that we have. And they're uncomfortable with maybe the old news about hormone therapy and what the risks and benefits are. Does that make sense?
Interesting. Yeah, of course. Yeah, and it's always good to ask that question for myself, because just knowing what the first step to do is, in my opinion, what we should always start with, and rather than, like we mentioned before, looking at the whole picture of things and kind of getting overwhelmed as to where
Yeah.
to start. I think education point is definitely the first thing. Let's get educated
And
on what is it,
coming back
what
to
the
that full
symptoms are,
circle
and
of Google, like Dr. Google, there are some great online resources because, as we said, there are a lot of barriers to care, access, and cost of care in the US. But things like letstalkmenopause.org or menopause.org are great resources that are free, where there's a ton of information that people can do some reading and listen to some webinars, listen to some talks. There are great podcasts. So I do think that we've seen great improvements in that if you know how to find good information.
And you're actually part of some of this information as well. Where can we find more information?
Yeah, I would go to menopause.org, which is the Menopause Society, and letstalkmenopause.org is a nonprofit that I'm chief medical advisor. We welcome a ton of talks on there. We try to be evidence based, best practice, but also welcome a lot of experts to talk about subject matter that are interesting to people. Because I think you've got to, as we said, you've got to meet that need of the people where they are.
Awesome, awesome. And I'll have everything in the description below as well as any social links for Robin. For everyone out there, I appreciate if you want to learn any more about menopause or what Robin is doing, go on those links below. Robin, I appreciate your time today. Thank you so much for
My
being
pleasure.
part of
And
the
lastly, I would
podcast.
just say we also continue to advocate for better information, free information, lower cost of pharmaceuticals. So there are a lot of problems in healthcare right now, but we are trying. Take care. Have a good night.